Hello, my name is Dr. Rajna Golubic and I am an NHR Academic Clinical Fellow in Diabetes and Endocrinology at the University of Cambridge. And here I'll be presenting the work which I've done in collaboration with the NetPro Global Center for Nutrition and Health based in Cambridge. This is data from retrospective analyses from UK primary care data, focusing on an intervention to reduce carbohydrate intake among patients with type 2 diabetes and pre-diabetes. And this is what we did. So the intervention involved patient-based goal setting and explanations of glycemic consequences of sugary and starchy carbohydrates, which was incorporated into 10-minute primary care consultations with a GP and group work. So what we did is we showed commonly consumed items in the form of an infographic. So here you can see types of food and their glycemic index and serving size and how many spoons of sugar the carbohydrates correspond to. And importantly, this intervention has been endorsed by the National Institute for Health and Care Excellence, also called NICE. And NICE in the UK is a key authority that regulates clinical guidelines. We presented standard cardiometabolic risk factors as medians and corresponding interquartile ranges. We had 122 patients with diagnosed type 2 diabetes and 67 patients with pre-diabetes. And parameters we showed here include body weight, body mass index, hemoglobin A1C, blood pressure, both systolic and diastolic, and lipid profile. And this is what we found. So here in table 1, what we can see are baseline characteristics of the patients, both pre-diabetic and diabetic population. And table 2 shows the change in all these cardiometabolic risk factors after the intervention. And the intervention lasted, the median intervention duration was 20 months for the diabetic population and 19 months for pre-diabetics. Importantly, so what happened at the end of the intervention, we observed quite marked reductions in weight and HbA1c, which is shown here in table 2. So in terms of pre-diabetics, a median weight loss was 6.7 kilos, and in diabetics 7 kilos. And in terms of HbA1c reduction, we observed 5 millimoles per mole reduction in HbA1c among pre-diabetics and 16 millimoles per mole reduction in HbA1c among diabetics. So what can we conclude from this work? So this work emphasizes early prevention through non-pharmacological approaches in the management of type 2 diabetes and pre-diabetes, focusing on a simple, adaptable, and scalable low-carbohydrate dietary intervention in the primary care setting. Our results demonstrate an improvement in all commonly measured cardiometabolic risk factors, with the greatest benefits observed in weight and hemoglobin A1C. And given the very low cost of this intervention, it has great potential implications on healthcare cost savings, and we need to trial potential implementation at scale. However, we need to consider several limitations when interpreting this data. This was purely service data rather than a research project, so we didn't have a control group. This was not a randomized trial. We didn't do power calculations, and we did not use a pre-specified a priori sampling frame. In conclusion, these findings provide a justification for a design of a pragmatic randomized controlled trial to assess long-term effectiveness and scalability of this intervention in the healthcare system.